My name's Melissa. I'm going to be your nurse today. I have you here today because we're doing a head-to-toe assessment. Can I have you verify your full name, date of birth?
KB 090206.
Perfect. Just going to get started by asking you just a few questions, okay? Do you know where you are today?
Syracuse, New York.
Okay, great. And do you know what you had for dinner last night?
Spaghetti and meatballs.
Perfect. Let's see what else we're going to ask you. So what are the similarities between grapes and bananas?
They're both fruits.
Okay. Do you know what you did for your birthday last year?
I had a pool party.
A pool party, that sounds fun. And then if you were to find a cell phone in school, what would you do with that?
I would pick it up and take it to the main office.
Great, so I've established that my patient is alert and oriented. Her recent and remote memory are intact, as well as her judgment and abstract thinking. So moving on, I'm just gonna take a quick look at your general appearance. Okay, I'm just gonna move your shirt if you don't mind. All right, so I can tell that my patient is appropriately dressed for the weather. Her skin pigmentation looks great. It's normal for her ethnicity with a little bit of pink undertones. Overall, I'm not seeing any lesions, bruises, scars, nothing really observable, no swelling. I'm gonna just do a quick little pinch. There's no tenting, which is great. So overall appearance looks good. There's nothing that really stands out there for me. I'm gonna just go ahead, because this is a head to toe assessment, I'm gonna go ahead and start from your head and work my way down, okay? So over here, I'm just gonna take a quick look at your head. So overall, the shape does look normal cephalic. I'm not seeing anything abnormal. Size is appropriate. I'm just gonna feel the back of your head if you don't mind. Tell me if you feel any tenderness, okay? Any tenderness with that?
No.
Good. Hair distribution is great. It's blonde, it's thick. I'm not seeing any bald patches. So that's wonderful. All right, so moving on, I'm just gonna continue to palpate around your face here, okay? So we're gonna take a look at your lymph nodes next, okay? So we're gonna go right here for the preocular, pre-auricular, post-auricular, submandibular, submental, and let me know if you feel any tenderness at all, okay? And then we've got the deep cervical chain, occipital back here, post-clavicular, and clavicular. All right, so I didn't notice any tenderness there when I did that exam. Did you feel any tenderness? I didn't feel any nodules, bumps, or swelling, which is great. I'm gonna go ahead and just take a look at your ears next, okay? So I'll pull your hair back, and I'm gonna just inspect the exterior or external ear canals first. So as I'm looking at her ears, I do not notice any redness, drainage. There's no cerumen coming out. She does have both ears pierced. Okay, so next thing I want to do is just take a quick internal look, okay? So I'm going to use my otoscope. In order to do this exam, I'm going to pull the pinna up and back. I'll have you sit nice and still, gentle. All right, so I can see the tympanic membrane. It is translucent, shiny, pearly gray. I'm not seeing any redness, excess cerumen. There's no drainage in that ear, and the cone of light is at the 7 o'clock position here on the left. Let's go to the right side. Same thing, gonna pull the pinna up and back. And I can see the membrane is also translucent, shiny, pearly gray, no redness, no excess drainage, no impacted cerumen on that side either. So the ears look good that way. As I'm looking at her straight forward, I can tell that the ears are in a normal position, and I'm just gonna palpate your ears as well. Let me know if you feel any tenderness, okay? Great. So yeah, I'm not feeling any bumps, nodules, anything like that. All right, so next thing I wanna do is do an eye exam, okay? So we're gonna do a couple of things with the eyes. First thing I want to point out, noticing right away, is that her eyes are symmetrical. They're in the correct position and alignment, normal shape and size. All right, I'm just going to palpate underneath in the lacrimal apparatus here and above. And I'm going to pull your eyelids up and pull down a little bit. All right, so sclera is white and conjunctiva is pink, which is normal. All right, so I don't see any obvious drainage. Do you have any itchiness going on, anything like that? Wonderful. So next I'm just going to do a series of eye tests with you, okay? So I just want to check how your pupils react to light. I'm going to go ahead and just you're going to look right at me. I'm going to shine this light right into your eye, okay? Keep your eyes nice and wide open. All right, and that pupil is reactive to light. Over here. Perfect. Reactive to light. All right, so right here, this pen's going to be right in front. I want you not to move your head. You're going to follow this pen in as I go in and touch your nose, okay? All right, perfect. So she does have convergence, which is a normal exam there as well. The other thing I want to do is we're going to do extraocular movements, we're going to test for that, okay? So I'm going to use this pen again. You're not going to move your head, you're just going to move your eyes. You're going to follow the pen, okay? Good. Perfect. Back to the center. And the last test I want to do is a peripheral vision test, okay? So I'm going to have you cover your right eye. Perfect. I'm going to cover the same one over here. We're going to hold the pen over here. You tell me when you can see the pen enter your field of vision, okay?
No.
Good.
No.
Good.
No.
Good. And we're going to switch sides. Over here. Same thing. Okay.
No. No.
All right.
No.
Good. All right. Everything is normal. Last thing I want to do is I'm just going to use the ophthalmoscope and take a look at your red light reflex, okay? So I'm going to go in right here with the light. And what we're looking for is that red border to come through, reddish orange border, and that is happening for us, so that's a normal exam as well. All right, so next thing I'm going to do is inspect your nose, okay? So looking straight ahead, I can tell that her nose is in the correct position. It appears symmetrical. I'm not noticing any deviation of the septum externally, which is good. I'm going to just use this otoscope again. We're going to take a peek inside at your nasal membranes. All right, so they're nice and pink. I'm also not noticing any deviation or septal perforations in there. A couple of things we want to do with the nose. We want to just check nasal patency. So I'm going to have you cover one nostril at a time and breathe in, okay? Good. Other side. Any difficulty breathing that way at all? Good. So I do want to have you close your eyes because I'm going to do a smell test, okay? And then I'm just going to wave this in front of you and you tell me what you smell.
Coffee.
Perfect. All right, and then one more test we didn't do for hearing. I want to just make sure we cover that as well. I'm going to stand behind you. I'm going to whisper 3 words, and then you tell me what I said, okay? All right. Car.
Car.
Oh, I'm going to whisper them, and then you say them after me, okay? So, car.
Car.
No. I have to say all 3.
Oh.
Okay, perfect. We'll start that over. Okay. Car, star, sky.
Car, star, sky.
Perfect. I'm going to do the same thing on the other side, okay? All right. All right, let's think of 3 new words here. Seat, chair, sky.
Seat, chair, sky.
All right, perfect. So I think your hearing is good. Okay, so we looked at your nose. I do want to palpate the frontal and maxillary sinuses. Any tenderness there? Nope, good. I'm not noticing anything either, so everything looks normal. Let's move on to the mouth, okay? So first thing I want you to do, just open your mouth way wide for me. I'm gonna take a peek inside, okay? Good, membranes are pink and intact. Her lips are also pink and moist. I'm not noticing any cracked lips or dryness. Stick your tongue out for me. All right, tongue looks good. There's no lesions or patches there. Swing it side to side. Good, and then touch the top of your mouth. All right, and down here looks good. Dentition is nice. I don't notice any chipped, cracked, loose, or broken teeth. And then stick your tongue out for me and just say ah. All right, hard and soft palate are intact. Ah again for me. Uvula is midline and rises appropriately. I also took a quick look at her tonsils. I did not notice any redness, swelling, patches, or exudate coming out with that also. All right, so we're gonna move on to the next body system. I think what I wanna do next is just your chest area here and your back, okay? So I may actually set this butt up a little bit so we can do a little bit better of an exam here. Go ahead and lie back for me. All right, so I'm gonna move these necklaces out of the way, okay? So looking at the chest area right here, we can see that it's flat, it's even, it looks symmetrical. I'm not noticing any obvious redness, swelling. Everything feels normal. We're just going to palpate real quickly. I'm going to feel for the apical rub, so that's in the left 5th intercostal space in the midclavicular line, which is right here. And I can feel the apical pulse, which is a normal exam. I'm also going to go ahead and take a listen to her heart sounds and make sure that everything there sounds normal as well. We're going to listen with the diaphragm and the bell of the stethoscope. All right, so we start off by listening to the aortic area, which is the 2nd right intercostal space. And then we do the pulmonic, which is on the left 2nd intercostal space. Erb's point, which is the 3rd intercostal space. The tricuspid area is the 4th intercostal space. And the mitral area is in the 5th intercostal space. mid-clavicular line. All right, everything sounds good. I'm just gonna check again using the bell, okay? So again, aortic, pulmonic, Erb's point, tricuspid, and mitral. So I am hearing a normal S1, S2 sound. There's no murmurs, clicks, or gallop, so that's a normal heart sound that we're hearing there. What I want to do next is take a listen to your lungs on the anterior side of the body as well. So that's the front side, okay? So we start at the apex of the lung for this. We use the diaphragm of the stethoscope for this exam, and we're going to go right up here. And I'm just going to have you take some deep breaths in and out, okay? And we always listen side to side to compare. Moving down. And we're also going to listen to the lateral lobes. All right, perfect. So what I'm hearing are normal breath sounds. We have bronchial sounds up here, which are the highest pitched. In the middle, we have bronchial vestibular sounds, which are medium pitched. And down here, we have vestibular sounds, which are the lowest pitched. And that's a normal breath assessment on the front side. We're gonna go ahead, I'm gonna listen to the back side now. Okay, so I'm gonna put this back down. All right, I'm gonna move your hair out to the side here because we're gonna do a couple other things as we're listening to the lungs back here. I am gonna go ahead and just inspect the back for symmetry. Everything looks symmetrical. I'm not seeing any redness, swelling, lesions, scars, anything like that. I'm just gonna feel down your spine. And the spine does feel midline, and it also feels normal. Is there any tenderness there?
Mm-hmm.
And then right before we get started listening to the lungs, there is one other exam that's just easy to do right now, and it's just checking for CVA tenderness. So I'm just gonna give a little bang on on the back of your back here, both sides, and you tell me if you feel any tenderness, okay? Any tenderness with that?
No.
Good. So again, just gonna listen to the lungs back here. I will have you just take some slow, deep breaths for me, okay? And we're gonna use the diaphragm for this as well. Okay, deep breath. And we're gonna listen laterally as well. So on the front and back for the lung assessment, I'm not hearing any abnormal breath sounds. There's no wheezing, bronchi, crackles. We're definitely hearing the inhale and exhale, which is what we want to hear without the additional sounds in there. I am going to do another test back here. It's called tactile fremetus, and it's just to feel for a vibration. So we should feel the vibration stronger up here, and it should get diminished as we go down here. As I move my hand across your back, you're just going to say the word 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. So we are noticing that, yes, that vibration is stronger up here and it diminishes as we move down the back, which is great. One other exam I want to do is just going to measure making sure that it's symmetrical when you breathe in and out. I'm going to place my hands down here and I'll take a nice deep breath in, okay? Again, one more time. Okay, and I am noticing that my thumbs are rising symmetrically as she's breathing in and out, so that's a normal exam. All right, so next thing I'm gonna do is kind of another full body assessment here. We're gonna look at your neck, and I wanna take a look for any jugular vein distension, which I'm not noticing. I am gonna palpate your carotid arteries right now, okay, each side. All right, and I'm gonna come over here. Perfect. So they're both bilaterally equal, both sides about a +2, which is a normal finding. And the next thing I'm gonna do is I'm just gonna have you hold your arms out for me. I'm gonna feel your brachial pulses and the radial pulses. We're also gonna do posterior tubular pulses down here. And if you don't mind, I'm gonna remove these shoes because we are gonna do your dorsal pedis as well, which is right up here. All right, bilateral and equal both sides all the way down, so that's great. I'm gonna have you lie back so we can do an abdominal exam next, okay? I'm just gonna pull this out. Feet right here. All right, so I'm just gonna take a look at your abdomen first, okay? We're gonna take a peek at everything. Everything looks symmetrical. I'm not noticing any redness, swelling. There's no obvious masses, anything like that. Her stomach is nice and flat, normal pigmentation throughout. And then the first thing I'm also going to do is just take a quick listen with the stethoscope again. We're looking for active bowel sounds in all 4 quadrants. So, just going to take a quick listen. All right, and so there are active bowel sounds in all 4 quadrants, which is a normal finding. Next thing I'm going to do is just a light palpation, okay? I'm going to palpate every quadrant, and you just let me know if you feel any tenderness at all, okay? Any tenderness there? Good. Good. All right, I didn't feel anything abnormal, and you did not, I didn't notice any guarding. She's not retracting in any way, so that's a normal exam. All right, so I'm gonna do a little bit of percussion too, just to make sure that none of your internal organs are abnormally swollen, okay? So just a little bit of a percussion. Again, not feeling any enlarged liver or spleen, which is wonderful. While I have you lying down here, I am going to start to do a little bit of the range of motion exam that we do and a strength test, okay? So we're going to start with the hips. I want you to lift this leg straight up, okay? Perfect. Bring it back down. Other side. Good. And I want to do the same thing. Now just try to go against my hands. Try to lift up. Good. Other side. Good. And then lift this leg up again for me and try to push it down. All right. Other side. And push it down. Good. So that was normal. Strength is equal on both sides. She is able to lift her legs and flex and extend those hips, which is great. I'm going to have you bring your knees right up like this. Other side. And just bring your knees out and back in. Any discomfort there at all? All right, push against my hands. All right, and then try to push them in. Good. Strength is equal on both sides there as well. Bring your feet back down for me, and we're going to just check the ankles while we have you lying here like this. So I want you to bring your toes all the way back. All right, and push them all the way out. Good. I want you to do the same thing, and then try to go against my hands, and then push against my hands. All right, strength is good in the ankles. I actually want to have you do one more maneuver. You're going to tilt your ankles inwards and outwards. Good, that's great. All right, I'm going to push this in. You can sit up for me, okay? So I'm going to have you actually stand up because we're going to do a couple more range of motion tests here. And what I want you to do is just follow along with me, okay? You're going to bend this knee back and down. Same thing. And down. And then we're going to bring our arms out and all the way back. And I want you to cross them behind you like this. And then again like that. Perfect. All right, so bring your arms out like this. And I want you to push up against me. Good. Pull down against me. Good. Can you bring your shoulders out like that? And down like that. And the same thing. Test. And then push against me down here. Good. All right, strength is good there as well. Range of motion looks great. I'm going to take a quick peek at your hands. And I'm not seeing any contractures. I'm going to do a quick capillary refill test here. Her nails are painted. This is a clear nail I can see underneath. And capillary refill is less than 3 seconds, which is a normal finding. All right, so the other thing I'm going to do is test your gait. So what I want you to do is just, you watch me and then I'll have you do this. You're going to, just like this, across the room, okay? Perfect, and I'll have you turn around and do the same thing. And then I want you just to bend over, so you're gonna just, I'll have you face this way though, okay? All right, good. And what I'm doing here now is I'm just looking at the back, looking at the curvature of the spine. I don't see any deviation. I don't notice that one shoulder is higher than the other, so no evidence of scoliosis there, and no abnormal curvature of the spine there. Perfect. So we're going to do a couple sensory tests now to kind of wrap things up today. I'm going to have you sit back down for a moment. And one of the first things we'll do is I'm going to have you close your eyes. I'm going to put an object in your hand and you tell me what it is, okay?
Paperclip.
Paperclip, perfect. I'll have you close your eyes again. Hold your hands out for me, please. And I'm just going to draw something in your hand and you tell me what I drew, okay? A, perfect. All right, so that's another good test. Open your eyes to me. So I want to check your cerebellar movement and make sure that that's intact. So I'm going to have you follow along. We're going to do a rapid movement test. So you're going to touch your fingers like this and just keep going back and forth, okay? All right, good. Wonderful. I also want to just do a quick check of your reflexes. So I'm going to go ahead and just check your knee reflexes real quick. I would normally do this with a hammer, and we don't have one in the office right now. So, and that should kick out, and that's normal. And that kicks out, and that's normal. And then the last thing I'm going to do, I'll have you lie back. This is going to conclude our test, our head to toe assessment today. I'm going to draw a J on your toes, and then they should react, okay? So let's see. So they should normally curl in. That's like a normal thing that happens. Let's try this side. Good, so they curled in. That's what we want to see. Perfect. All right, and that does conclude our head to toe assessment today. Do you have any questions for me? Perfect.